The start of the COVID-19 pandemic created a lot of uncertainty in our world, creating another pandemic of its own, the downfall of many people's mental health. Bain Froney takes a look back at what we saw over the past 2 years.
March 13th, 2020, COVID-19 changed life as we knew it.
The federal government did this effort today. I am officially declaring a national emergency.
Businesses shut down, schools closed, the unknowns were endless.
In the early months of the pandemic, there was just a lot of uncertainty and fear.
During the first 6 months, the majority of people seeking therapy or counseling were experiencing anxiety. The world looked different and no one knew what to expect.
You know, it was something new for everybody and nobody had an answer. Nobody knew what to do next or what was going to happen next. And so I think more than anything, there was just a lot of fear, a lot of uncertainty, and people acting out of impulse. As the pandemic progressed, we noticed things getting worse.
In the first year alone in the pandemic, anxiety and depression increased by a massive 25%, according to the World Health Organization.
A lot of people are experiencing depression and anxiety who haven't before.
And while wearing masks and COVID tests became normalized, mental health was at an all-time low.
You know, some things we started getting used to, like working from home and things like that. And, that's not necessarily a bad thing. But then I think one thing we did notice is a lot more depression, a lot more anxiety, because people were very isolated.
From not being able to go to work, staying home from school, unable to see friends and family, depression was on the rise.
You know, if we're not able to have physical touch with people and we're not able to actually interact with people in person, it can really do terrible things to our feelings and our thoughts. And so we noticed a lot of people just really feeling so alone.
But now, over 2 years since the pandemic began, COVID precautions have loosened. Businesses are up and running, but the effects of COVID-19 still linger.
People are getting more interaction with others, which is great, and they are getting back out. And I think fear is starting to lessen for a lot of people. But I think there's still this looming question of what is going to happen next.
And while COVID-19 brought on stress, anxiety, depression, grief, it has also shone a light on the importance of being mentally healthy and also seeking help.
So I do think people are starting to ask for help more because things are getting back to being more in person, and they're having more chances to connect with people, whether it be a trained mental health professional or just a friend, a family member, a coworker.